Hi, everyone. Okay, we're live tonight. I wanted to welcome everyone to our 7th virtual town hall that Assemblymember Linda Rosenthal and I have been hosting over the last couple of months. A quick update, as Governor Cuomo mentioned a few weeks ago, thankfully, the worst of the COVID-19 crisis appears to be behind us, but we have to remain vigilant. Some key public health indicators continue to trend in the right direction. The number of New Yorkers admitted to hospitals with COVID-19-like infections continues to drop. Yesterday, there were 113 new hospital admissions compared to 181 just 10 days earlier. The number of patients in critical care settings is also going down slowly. Yesterday, there were 645 such patients compared to 786 10 days earlier. But sadly, of course, the deaths continue. Yesterday, there were 280 deaths that we have to be mindful of devastation of this illness. The previous day, there were 299. In total, New York has 313,000 confirmed cases of COVID-19 and more than 18,000 total deaths. As we go down the apex and flatten this curve, the governor has announced plans for a phased reopening of the state, and that's what we're going to be talking about tonight. He's calling it Unpause New York, and the approach, as we'll hear tonight, will be regional. Different parts of the state will reopen at different times, only after experiencing a consistent 14-day decline in hospital rates. Certain businesses are going to receive priority for reopening based on whether they're classified as essential and whether it's possible for them to reopen while maintaining safe social distancing. And the governor has appointed a New York Forward Advisory Board, a panel of business leaders who are going to advise the state on how to move forward. So there's a lot to discuss tonight, and there's a lot to do before we return to anything resembling normal in New York. I'm going to turn it over now to my colleague, Assemblymember Rosenthal, to introduce our guests tonight. We're going to share their thoughts about reopening New York. Linda?
Hey, Brad, and hi, everyone. As Brad said, it's our 7th. Our ratings are going up. Thank you all for watching. It's really it's a new way to be in contact with people, and we're happy and lucky that we can do it together. As Brad said, looks like hospitalizations are going down. The worst is possibly behind us, and the state is working to safely reopen. The governor's plan to reopen is measured checkpoints for testing and tracing, which is thought to be the key strategy to reopening the state healthcare capacity and total new cases that all regions must achieve in order for them to open and move forward. So I know a lot of us are anxious to get out there with the nice weather this weekend. I saw a lot of people out there, some without masks, and that's something perhaps Vincent will discuss. But we have 3 guests tonight. Executive Vice President for Small Business at the state's Empire State Development is Pravina Raghavan. We also have Marion Phillips of ESD, the Senior Vice President for Community Relations. And we have Vincent Racaniello, who has been a guest on 2 previous episodes. So let's start with Vincent. He is a Higgins Professor in the Department of Microbiology and Immunology at Columbia University's College of Physicians and Surgeons. He has done laboratory research on viruses for more than 40 years, starting with his PhD program at CUNY and continuing to this day. He studied many viruses, including influenza and polio, and certainly he's learned a lot about COVID-19. So Vincent, go ahead. Thanks for being here.
Thank you. Good to be back. I'm glad we made it to my third appearance.
Yes, you're a popular guest. Would you like to make an opening statement?
Sure, I'd love to. I think it's great that we have a plan to return. I wouldn't call it normalcy yet, because that makes people think they'll just pick up where they left off before. I just want to remind everyone that the virus is still around and we have very low population immunity. You know, in New York City, it's pretty good compared to other parts of the country. Maybe it's about 20%, which is much higher than we thought. But that leaves 80% of us vulnerable. And New York City is unique because on any given day, you can encounter hundreds of people. So I think we have to talk tonight about the ways to avoid having more waves of infection. I think we can do it, but there are ways that we have to talk about doing it.
Okay, thank you. Our next speaker is Pravina Raghavan. She's Executive Vice President, Division of Small Business and Technology Development for Empire State Development. She has 20 plus years of experience in providing strategic advisory services to businesses in the startup, growth, expansion, and maturity phases of development. Prior to joining ESD, she was Senior Advisor to the Deputy Secretary of the U.S. Department of Commerce, District Director for the U.S. Small Business Administration's New York District Office. And we're going to be looking a lot to the state and to the state ESD to guide us to a reopening of businesses. Please talk.
Well, thank you very much, Senator and Assembly Member. I really appreciate having my first appearance on your 7th series, so I'm very excited. I am also joined by my colleague, Marianne Phillips, who will discuss a little bit about reopening, but many of your guests may not realize that the state has a small business arm, and we have actually over 30 programs to support small businesses. But in this time of crisis, we've actually launched 2 new programs recently, just focused on the 98% or the 530,000 small businesses we have, as well as the 676,000 gig economy employees we have across the state. So you're looking at about 1.2 million individuals we employ that are trying to figure out what to do now. We have opened up all our resource partners. We have 70 resource centers across the state working to help small businesses as well as nonprofits and gig economy workers understand the federal stimulus programs that are out right now. I would encourage people to go and talk about PPP. It is still available this week. And small businesses, truly small businesses with less than 20 people, are able to get those loans. The average loans are now sizing about $23,000. So I think, we really want to help encourage all this information, because I know we're on Facebook Live, is on esd.ny.gov. The resources we have, as well as the fact that we have 4 CDFIs, which are community development financial institutions, smaller institutions across the state, that we have given loan capital money so that they can participate in this program to really hit those small businesses with sub $50,000 loans, because we realize right now it's tough. And as we go to reopen, we've been working with the New York Forward team to make sure that we have other products and services rolled out at the same time of reopening to actually support all the businesses. And it will be a new normal. It's not going to all flick on with a switch. We're all going to have to figure out new procedures. How do you get working capital? How do you actually turn on the lights? How do you have new cleaning protocols? And that's why we have free services to make sure that people have a resource to go and talk to about how does business look post-COVID. So I'm going to turn it over to my colleague. I'll turn it back to you, Assembly Member, and then over to Mary.
Okay, Marianne Phillips is a Senior Vice President for Community Relations at Empire State Development. And please.
Good evening, everyone, and to Senator Hoylman, to his opponent. Most of all, thank you for allowing ESD to come be a part of this town hall. I too am grateful for my first appearance on this episode of town hall. Having said all of that, I think the governor is very clear when he put together a 100-person committee to help figure out the best way to reopen New York or to take New York off of pause. He also plans to listen to the business leaders. I'm being told I can't be heard. We also plan to make sure that we're going to listen to business leaders, but we want to listen to the medical community to make sure that there is no relapse. Or if there is a relapse, it's a minimal relapse. We want to make sure that New York State opens in a very responsible way. We're going to open by region. That's what the governor has said, looking at North Country and looking at specific industries, starting with manufacturing and construction. And the reason for that is those are the industries that provide opportunities for greater ability to social distance while working. And New York City, as he said, I believe yesterday, will probably be the last region to come online. He's really saying downstate. And the reason for that is we are the epicenter of the epicenter. Also, you're looking at the density in the population, and it's going to be very difficult for us, meaning us New York Cityers, to be able to social distance. The governor is not going to do something based on politics. He's not going to do something based on screaming. He's going to do something that's based on the best health, physical health, and the physical health of New York State. And I think working with you legislators, he's going to put a plan together that brings New York State back and brings New York State back in a very strong and productive, positive, and very responsible way.
Thank you. Okay, I think I get the first question, and it's for Vincent. So let's start with an update on the virus itself. Looking at the data from New York, have we successfully flattened the curve, and what benchmarks are necessary, according to your research and knowledge, for us to meet before we reopen?
So have we flattened the curve? We have. We got started a bit late, but we did get started. And by the time we started, there were already thousands and thousands of ongoing infections. And that's why, even though we were all home and businesses were closed, schools were closed, that's why the cases accelerated and accelerated. We got very close to capacity of many hospitals, but we did a good job in taking care of that. I think that's the barometer we have to look at. And it's my understanding that one of the key indicators is a decrease in the number of hospitalizations, for 14 consecutive days. That's important because that's what the whole flattening is all about, keeping people out of the hospital, because 80% of these infections are mild. It's the 20% that we're worried about. We don't want to overburden the healthcare system. So we did flatten in the sense that now the curve is going down. It's on the other side. If you look at them on a daily basis, it's wonderful. The number of cases daily are decreasing. Now, there are certain days where you see a lot of deaths, but remember, some individuals take 2, 3, 4, 5 weeks before they're dying. And so these were infected a long time ago and don't really reflect what's going on now. So it looks good. And we do for sure have to think about going back. But as I said earlier, the virus is still out there. And we don't know how much longer it's going to circulate in a big way. It may fizzle out in a month or so. But I think when we go back, we have to take care of it, that we don't encourage more infections. We can talk more about that later. But I just want to put in everyone's mind, the virus is not gone. With only 20% of the population immune at best, a lot of people out there. And as soon as you start going out, we could see pockets of infection. And I think we can avoid having to close down again. So I think we're in a really good spot here. There are many parts of the U.S. that have very few infections because they're very rural and they're likely not to experience the kinds of infections we have. And so they're at danger to have virus reintroduced as well. So looking forward, what I'm looking at now, I'm looking at the number of cases, of course, but I want to see globally if virus is slowing down. It's always been my idea that with the warmer months, the high temperatures and humidity, virus circulation will be impacted. And I'm hoping we can get through the summer with that and get kind of a semblance of back to normal, because in the fall, as the temperatures drop and the humidities drop, I think we'll have the virus coming back. And I think we need to be prepared for that.
Thanks, Vincent. And I just have to comment on your great studio, as well as the electric guitar behind you. Just to drill down a little bit on Linda's question, in terms of that 20% of New Yorkers who may have some immunity,
Mhm.
that's based on what, could you tell us? And how confident are you that antibody testing is actually accurate? It's my understanding that there's a lot of antibody tests out there. I believe Congress had a hearing last week that shows maybe 1 in 3 tests have inaccurate results showing false positives for between 10 and 16%. That's pretty alarming to think that New Yorkers might think they carry the antibodies, but the test is actually giving you a false positive. Any thoughts on the accuracy of these antibody tests, and is 20% really the number?
Oh, that's a great question. So these are tests to figure out if you have been infected at some time in the past, right? They're looking for antibodies which your body produces in response to infections. And these are all brand new tests that are being developed. We haven't made these before. This is a brand new virus. We're making brand new tests, and there's likely to be some inaccuracy for sure. And some tests may be better than others. We don't know which. But yes, even if there's a 10% inaccuracy, that's not good. And that's why I think we have to go back with the assumption that the tests may not be telling us all we need to know, and simply take precautions as we go back. That can mitigate any problems. We do know that the curve is going down, and that is most certainly a reflection of increasing immunity. So we may not be 20%, but we're some percentage, and that's helping us. So I think we don't have to worry about the tests. We shouldn't base everything on an antibody test. I think they can be informative, but I think other things that we do can mitigate and prevent getting infection if in fact some people aren't protected. Because at this point, I view the test as an experiment. We're not sure if they're telling us you're immune. We're going to find out very soon.
Well, let me just, one more question, which is, I just spoke to a constituent who had sounds to me like a very bad case of COVID-19, went to the hospital, young man, had some respiratory issues while he was ill. He recovered. His husband also had the telltale signs of losing his taste and smell. They both were tested for antibodies afterward. The husband, who had only the taste and smell impact, but who lives with him, tested negative for antibodies, while the husband's antibodies were off the chart. Is it possible that if you have the condition more severe, you demonstrate more antibodies, but if you're asymptomatic, you may not have any protection?
Well, it depends on, so antibodies usually are made even if the virus is not actively multiplying in you. You can just have an encounter. That's, some vaccines are based on that. You get a shot and the virus is inactivated and you still make antibodies. So you may not have had an actual infection. You may have just encountered the virus. But I think that's an example of where the test may simply be wrong. And that's a false negative, for example.
Yeah, there's an article in the Times entitled, "Italians Find Promise of Antibodies Remains Elusive for Now." So Italy had this plan that they'd issue certificates, you're immune, you're fine. But a doctor there says, we don't know if everyone who has had the disease has developed an acceptable protective immunity. And infected people develop different quantities of antibodies. Researchers still studying the level that offers protection. So while that may be a guideline for how many people may have had it or have antibodies, it's really not something that reliable. Would you agree?
I think we can use it as a guide, but it won't, at this point, it's so new, we can't use it for the last word, but it certainly is part of a multi-component program to get people to work.
So if someone tests positive, they have antibodies, what does that mean to them? What should that mean to them?
So I would say in terms of going back to work, if people are testing positive, they can have more confidence that they're not likely to be infected. You know, in health, nothing's 100%, right? And so you may have antibodies, but maybe you can get infected. But I would say if you got infected, it would probably be a very mild disease. But there, our main concern is that you're going to spread it to someone else, of course. So that's how I view the antibody. It can give you confidence that you can go into the workforce. You should still take the precautions that we're going to talk about, but it can give you some confidence that you're protected.
Okay.
So Pravina, since the governor is basing a lot of his reopening strategy on this perhaps 20%, antibody partial immunity, does it give you concern to hear that these tests may not be as accurate as we would want them to be? Are we opening up New York State based on a kind of thin premise that Linda points out Italy is now kind of grappling with?
I mean, I think one of the things the governor has said, and I think you've been watching what I like to call the Love Gov Hour, because that's what they're calling it. It's based on data and science. Like, so we have a committee to actually look at everything, right? And even with that, it's going to be precautionary measures. I think everyone thinks a light's going to flick on and we're all going to do what we did, in February and January. Well, that's not going to happen, right? It's going to be months for us to really look at the impact and things from, right now, liquor stores in the state have curbside pickup. It's, it was an executive order to do that. It'll continue, right? Still takeout. Will we allow restaurants? I mean, we're all New York Cityers, I think, on this call and this Facebook Live. You literally don't have 6 inches, let alone 6 feet apart from someone. So do we only allow takeout to happen? So a lot of what we're looking at in reopening is looking at the regulations, as well as what type of PPE, protective equipment, is available, how far apart people are, how much is the interaction, and really monitoring that. And that's why I think it's region by region, right? Some regions are going to open up quicker, but not everything. And in fact, the governor said retail is probably going to be one of the last things open, because there's just that constant contact. Even if you are in a rural area, go to the grocery store and you're still going to be encountering people. So I think a lot of it is database. And I think people realize the reopening is going to be months, right? And it's going to be in phases, and we're going to wait and see what the numbers, and hopefully the numbers continue to go down and we get herd immunity over the course of time, where we get a vaccine or something. But it's not going to be flicking overnight, which is why a lot of the resources we're talking to small business owners is you've got to rethink your plan when you open, because it's not the same amount of customer uptake. You're going to have to figure out, maybe you start going more online. Do you have to hire different resources, and really looking at that plan? Because when you go back to business, your health of you, your staff, and your customer is so important, but you're going to have to do it within guidelines, right? And if you can't do them with those guidelines, is it prudent to open up? And that's going to have to be a question that people need to walk through, because it's not like, hey, I turned off the lights and I'm turning them back on.
Yeah, I think some people, I know the governor keeps saying it that way. I think some people, though, haven't gotten the message, and they're the ones who don't wear the masks and don't keep
I saw a few of them today.
Yeah, I saw them, and there are pictures circulating of people in the Village and people in Central Park and people in Prospect Park sitting in tight clusters without masks on. So Pravina, maybe you can go through ESD's role and what your approach is toward different businesses and how they can open up. You mentioned retail and restaurants, but maybe you can go through some of the things that you are dealing with at ESD.
So as you know, ESD has been at the heart of figuring out essential businesses. And now we're at the heart working alongside, obviously, this New York Forward team, our Department of Budget, and everyone in the governor's office, giving input into what is the new norm, as I like to call it. And every industry is different, right? You saw, as Marion highlighted, the first industry looking up is manufacturing and real estate. And the reason we've even talked about, well, what does that mean for manufacturing? Because some floors have really big spaced out, and they have robotics in it, and there's artificial intelligence. Do those manufacturers go up first versus the guys who are literally on top of each other? So it is actually looking at each of these industries and trying to figure out spacing, how to, there goes my camera. Gotta love, it's Facebook Live, right? So
It is.
live. has spacing, protective masks? Do the companies actually can afford to actually put PPE, right? It's up to the company to ensure that their workers are having the equipment and the ability to enforce the regulation. So there's a lot of talk about different industries. No one has the magic answer yet. And that's why we're actually working hand in hand with the industry, as well as, the constituents across the state, to figure out what to do. We obviously have farmers upstate that have excess product. We're trying to get them down to food banks. Like, how do you ensure that all happens? But we're looking industry by industry, sector by sector. And this is the first time in any of our, in fact, in my life and for the last few emergencies that we've had, that we've affected the entire state in every industry, right? We always think about Hurricane Sandy, we think about a 9/11, but they affected certain industries and certain sectors in the state. Not again, this is everybody. Like we talk about it from the man, our programs help people who are the guy or gal who are at your food cart, all the way to high tech businesses. Even they are trying to figure out how do they survive in here. So it will be going through sector by sector. And as the governor said, it's going to be in phases, right? It's going to be, let's open up one sector and see what happens. If we get a rise, we're going to have to shut it down again. So I think it has to be a very thoughtful approach. No one has the answers yet, but I will tell you there are teams working around the clock right now trying to figure it out, because we know May 15th, a lot of people are expecting to reopen. And what does that mean and how does that entail?
Well, I'd like to ask about construction, because a lot of our constituents are upset about construction and developers deeming that their project is essential when it's actually not, or claiming that they have affordable units when they actually don't meet the threshold to open. But we have one developer in our district who said they were going to have 45 workers there within a week. How can 45 workers, especially when we've seen the workers, they hang out together for lunch, and how can they distance themselves properly in order to make sure they're observing the guidelines and not endangering each other?
I mean, that's a great question. I mean, that is a lot. These developers, as well as real estate firms, have to figure out that way, right? I mean, the state can give you the guidelines. We can tell you what needs to happen. They've got to also put the choices. I think it's also working with your workforce, right? A lot of this workforce, they have to input. I agree. People are going to have to be kind of thinking about their own safety and the safety of others. And I think, if it's not deemed essential right now, it may be because of the way we can do it. I actually was telling someone, we may put up new construction sites, but robots may be doing a lot more work than you thought before. And people are like, wait, what do you mean? I'm like, robot doesn't get sick, right? A robot isn't going to have a problem. But actually, Marion has Marion has expertise in this area, and I'm going to defer to him on construction itself, given that's his big part of his portfolio.
Exactly. There are several projects in your districts, namely Javits. One of the reasons we're allowing Javits to restart is because they're doing outside panels, and those are brains essentially, and not men and women working side by side. Projects that are in still erection right now, those are the projects that are the easiest ones to allow to restart. So we're really looking at projects on a case-by-case basis, not on just one size fits all. And the reason for that is when you're under roof and you're starting to do just the final work, the last 15% of the work in residential, you are all on top of each other. So it is very, very difficult. Construction also has a number of other problems that we're running into, from everything from Belmont to Javits to Moynihan. I'm just naming projects in your areas. The other reality is some of the trades will not come in. That's just the reality. Certain unions will not send their workers in. And so it's really a very difficult balancing act for the developer. How do I restart based on X, Y, and Z, and I don't get A, B, and C coming to do the work? At a certain point, it's really diminishing returns for their efforts and their cost. So construction is one of those things, and I'm glad you mentioned the fact that you have one developer to claim there were 45 people coming on site and there were 100. Department of Buildings is really having to monitor some of that, as is NYPD. And that's across the state. I'm just using New York City since we're here tonight, but that's across the state.
Well, New York City has given these developers permits, so it's infuriated a lot of neighborhoods, especially the ones who are inside all day and have to hear the loud construction. But in terms of what's essential and what's not, I guess that definition is changing and what is allowed. It's just, it seems that developers are having their run of the town when many people, are inside and obeying the guidelines. And that's in New York City, it seems.
The only ones right now that are considered essential are the ones that have affordable housing components to the project or residential to the project. Other projects are not essential at this point. And the only reason we allowed Javits to restart was they're doing just the external panels. And the external panels are using cranes and men and women are far enough apart.
So I
That's
just wanted
far
to
away.
acknowledge, oh, excuse me, I wanted to acknowledge there's a lot of questions coming in, Linda, about forfeit days, which I think some of our panelists might know about, where there's a penalty for unemployment insurance applicants who are required to pay forfeit days and delay their uninsurance benefits. So just wanted those who are emailing us and messaging us about this. It's a very serious topic. Senator Monica Martinez has introduced legislation.
As have I in the
as-
assembly.
Oh, you're the assembly sponsor?
Yeah.
To waive forfeit days. So Linda, why don't you speak about it then, since it's.
Oh, sure. It seems that people who owed Department of Labor forfeiture penalties, perhaps they made a statement like they're looking for a job and DOL said it was misleading, so they owe a penalty. So what's been happening is that it seems the Department of Labor does not have the flexibility to undo those penalties. So the penalties are paid before the payment of unemployment is sent to the workers, ex-workers, and so some are left with no unemployment. And this is a state of emergency for people who've lost their jobs and have no savings. They have no money for food, no money for rent, no money for medical reasons. And so this bill says Department of Labor can suspend that forfeiture collection until after the emergency. So people will pay it back. They just shouldn't have to pay it back at this moment.
So we hope that the Assembly member's bill passes, but in the absence of that, we also hope that the governor considers an executive order. I know that Linda and Senator Martinez have been calling for that, and I joined them.
Yeah, we actually wrote to the governor on Friday, I believe it was, asking him to issue an executive order so that the many people who haven't gotten a check in months can have some relief and can have some money to buy the necessary items for their lives.
So Vincent, I wanted to, you mentioned a vaccine, which we're all waiting for. That would make Pravina and Marion's jobs a lot easier. And by the way, just a shout out to the state employees who I know are really standing behind the governor, if not literally, figuratively, as he has those love hours every day, providing him with information to get the state up and running and to protect our public health. But Vincent, like from your standpoint, we heard Tony Fauci say that maybe January, which would be an all-time record, Project Warp Speed for a vaccine. How likely is that? And what are the, and if not a vaccine, are you seeing any treatments on the horizon? I know one was just approved through a Gilead drug that I believe is an HIV treatment, but seems to have some efficacy.
So you're probably thinking of remdesivir. Now, this is not a solution. Remdesivir is an intravenous drug. You can't go and get a prescription and take it because you have to be in a hospital. You have to be quite sick. So it's only going to help very sick people. There are others being tested, but we won't know about those for some time. You asked about a vaccine. January would be a miracle. because it would be a year, and no one has made a vaccine that quickly. It could happen. However, here's what you have to understand. To test it, you need people to be infected. You need the virus to be circulating. And we think now it's slowing down. So it's unlikely we'll be able to test a vaccine over the summer. You may have heard that China doesn't have enough cases to test their vaccines now. They may have to go elsewhere. So it's more likely we're going to be able to test it in the fall. And it could be that after a few months, it looks good and it could be used in January or February. So that, that fall season is going to extend through next April, May for sure. And so a vaccine could impact that, but for sure it will impact the next fall season, the fall 2021. All right. But I always tell people, don't depend on a vaccine, don't depend on a drug. Right now, there are other ways that you can mitigate being infected, right? Because it's just too far in advance to make a difference at this point.
Is there anything about the component parts of this virus that make it difficult? Kind of like HIV, which constantly mutates and therefore, and hides in reservoir cells and, prevents, at least thus far, a vaccine from being effective. Is this virus showing a wily nature that is going to make it problematic? Or is this going to be like a straightforward, once we figure it out, we'll be on the pathway to success?
I don't see any indication that this is wily in the sense that it's going to get around a vaccine or it's going to make a vaccine hard. There are a number of different ways you could make a vaccine, and they're all being tried by over 70 different companies. And I'm quite sure that multiple vaccines will end up working. So I don't think we have to worry about not having a vaccine like we have had we've not had an HIV vaccine since we discovered it in the 80s, and it's just been very difficult. But this is nothing like that. I would say this virus is wily because it makes mild infections in 80% of the people. And that's the problem, that we don't know it's even circulating. But I'm sure a vaccine will work. Multiple vaccines will work. It's just that they're not going to be ready this year.
Margaret submitted a question that at some point people from all over the country and the world will come to New York City. So don't we need to see progress from other countries and other states before we let them come to New York City?
Who's that for?
Anyone who wants to answer that. You can answer it from a scientific viewpoint, and ESD can answer it from their business viewpoint.
All right. So scientifically, I think, if we're talking about going back to work, I think face masks have to be an essential part of it. I was listening to you guys talk about construction. They wear face masks a lot depending on what they're doing. So I don't think it's a burden to have them wear them all the time. That's the way you protect people when they're sitting in a park close to. I think we have to make that more de rigueur, and we have to have people coming in visiting. They have to have face masks. But I also think we have to have way more testing. We have to have antibody tests of as many people as we can to see who might be protected. Fever checks. I would say in a workplace, morning and evening fever check. And if someone has a fever, they get diagnosed. If they're positive, you do contact tracing. You see their contacts and you quarantine them. That is how you would stop an infection. And so travelers would be, I think, subject to the same.
Can you talk a little bit about contract tracing, both ESD when you answer the other question, also about a business opportunity for people who are unemployed? Might they be able to do the contract tracing? But Vincent, first, if you could explain how that works.
So if you come to work and you have a fever, they send you to a lab and you're tested and you're positive for the virus, then you have to stay home for 2 weeks quarantined. But then they will ask you, who have you been near in the last 7 to 10 to 14 days? Your family, your workplace, and then all of those people will be tested and, if necessary, quarantined as well. And that's how you limit the infection, by just seeing who you've potentially infected. But
there is a lag time, right, Vincent?
Yeah, sure. There is a lag time. About 2 weeks for sure. So you really need to you have to talk about a 2 week. All right, who have you seen in the last 2 weeks? That's hard, and you're not going to be 100%, but it's better than not doing that for sure.
And Pravina?
Yeah, sure. So on the contract tracing, because we were just talking about it. So the Bloomberg School, which is a top-rated public health school in the country, is in consultations with our Department of Health, actually, to develop an online curriculum for the state's contact tracing services. That, you know, it's a training program. It's an online exam that must be passed for people to complete the program, and it's a part of one of the biggest strategies of obviously us coming back and reopening the economy. Also, part of a lot of the guidelines will be something that the doctor has already said, which is yes, fever tests, contract tracing, all that is part of it. Wearing masks, a lot of it is going to be on the employers to ensure that their staff do it. And you know, that's where we were talking about construction sites and everything. It's a lot of it. It's a lot of enforcement of the people who are bringing people back to work, right? To make sure that they have all that. As for tourism, it's one of the largest revenues for the state, as you know, both from the perspective of attractions, but also all the second and third transactions that happens in hotels and restaurants and retail. You know, I don't think anyone has the perfect solution. It's not like tomorrow we're going to open up all the attractions. In fact, that's one of the last things that will be opened up are attractions. But people will always want to travel. I think it also is going to be going and working with the other regional partners we have, as well as the federal government of when bans are going to be lifted. You've got to think about our airports are one of the most highly trafficked areas in the country, if not in the world. And how are we going to have, you know, something as, you know, temperature checks and using innovation technologies? Like we are looking at different companies where there's one that has a drone that can go around spaces and actually take temperatures, you know, and then read them out. If we're going to have to start thinking of things differently, and when we go back to work and how we employ, because it may not be what we do today, which is the simple solutions. We're going to have to think of new ways to do them. But, you know, parks are opening is one thing. Having, you know, major attractions open is a different, and that's going to be one of the last things open because there's just so many people, right? And that's one of the biggest problems of New York City is we live on top of each other, whether we want to or not. And trying to make us go back to our new norm is going to be tough. But I think, you know, we are going to be, as the governor keeps saying, we are going to be looking at science and data and making and asking people, really appealing to people, you know, do it. A lot of people are wearing masks. A lot of people don't want to infect their family members and friends, and really thinking about what is the social consciousness that you're bringing, because I think you did a great job today when you said it's not about you getting sick. It's about making someone else sick and then getting the frontline worker sick because the nurse has to get sick and the ambulance driver, and then using, you know, you might have made 20 other people sick, and that's your responsibility for wearing a mask. So I think we all have to remember that.
Yeah, that's interesting you say that, because we got a message from Mary Alice. She says, in her studied opinion, after spending 2 hours near and inside Central Park yesterday, I would have to say that way too many of us are behaving as if we already are out and about with no rules or worries. Social distancing is pretty much non-existent in Hell's Kitchen and the theater district, unless you have the sidewalk to yourself. Perhaps you and your panel of leaders and experts can address that. It's not just social distancing we must cultivate, but also convenience we need to abandon and manners we need to practice. If you can't get the proper space between you and others on a sidewalk, how about pausing, slowing down, or going around before re-entering the flow? I think that's really good advice. But Rita, I wanted to ask you, you know, I wanted to make the point that not all attractions are the same, right? So one of Linda and my colleagues was saying the other day on the call that we have with the governor's office, and I agree, there's a difference between, say, a Broadway show and a museum, where you can, in fact, perhaps visit it in a timed manner, which the technology already exists. And maybe those types of attractions, those types of cultural release valves, you know, can bump up in the queue if we can determine those are safe. What do you think about that, Vincent?
I think it's a great idea. I think you see in supermarkets already, they let so many people in at a time. And I think that it ensures that you'll have space in between people. So in fact, that should be the norm, is not 100% of any capacity. It always has to be a fraction, and whatever that fraction is. I was just on a call last week with theater owners, and they're talking, I mean, they're in the biggest trouble because they have hundreds of people all next to each other. So what do you do?
What are
And
they saying?
they say, well, if we have 25% of the house full, we're going to lose money every show. We can't do that. And so they're going to be among the last, as you say, to go back to work. But you do have to have some kind of graded return and limits for sure when you can.
Well, you know, Brad and I in our neighborhoods, we've had this crisis building of empty storefronts due to numerous reasons, Amazon, rent, et cetera, et cetera. Now it's positively like empty on some blocks, and some small businesses like the pizza stores are doing booming business, but fine dining, for example, that's out, and other foods that are hard to transport. What can the state do for those kinds of businesses? Pravina.
So right now, yeah, no, I was on mute, so I don't
Yeah,
interrupt someone else's.
sorry.
Yeah, sorry. I look, I will tell you right now, it is a difficult question because, as you know, the state's in a deficit. So everybody's like, just go out. It's very hard to compete with $659 billion that the SBA is doing through the Paycheck Protection Program, as well as the other $100 billion that they did. And I did say billion, not million, billions dollars that they did from the SBA EIDL program. I know people have been very frustrated with that program. I'm not going to say, I think it's a very frustrating program. What was hopeful this last week is that a lot of small CDFI, small banking institutions got in and were able to get loans to their customers. And I would encourage people to look at the program, even though the forgiveness may not happen. It is a 1% loan over 2 years when it gets converted at the end of the year. It may give people an operating lifeline until we can get back to a normal where we can look at capacity, as you were talking about, as well as trying to help people figure out what does their new normal look like. This is why we are working with so many resource partners across the state and in New York City alone to have businesses actually start that conversation, because it's very hard right now to even contemplate, I can only have 25% traffic into my store, into what I do. Also, what is your online presence like? You know, when you talk about fine dining, specialty foods, do they have the capacity to do that? What's the cyber risks? How do you know how to take people's, you know, what's a good web presence? What's a good social media? All those questions need to be answered. And a lot of times when you feel so alone, which is what, you know, one of the things about this is social distancing, is also you start feeling lonely. The state is here to help. We are looking through these, and we already have resources out there. People don't realize we had gotten law firms, accounting firms, media firms actually volunteering on our Business Mentor New York to answer these types of questions for people. It's for free, right? And we're not going to come back and charge you $50 later. I've been watching a lot of late night TV where the guy's like, for $55, I'll solve all your problems. Well, we won't solve your problems for $55.
What's the website?
Sure. It's ESD, Empire State Development, so esd.ny.gov. And if you click on midway through the screen, it says small business resources. And on it, it gives you about the loan programs, but also other grant programs that are being done, like people like Facebook, the Ford Foundation around the city. And then also we'll give you all our resource partners and that Business Mentor New York resource that you can start thinking today about what you need to get done. And then as part of New York Forward, we will be launching other programs to help businesses. You know, we're in the middle of crafting them right now and trying to see how you do that in a budget constrained environment, because we will need to bring some cash to the table if we're going to make it work.
Mm-hmm.
You
And Mary?
Sorry?
Oh, I wanted to say, speaking of
wanna
social, this is a question for Marion and for Vincent. And it's just a question that came in from Paul. How do we reopen? Well, Penn Station is not closed, but how do we have an old Penn Station with social distancing? Vincent, what does that look like? I mean, the good news is we're going to be doubling the size of the train hall, right, Marion? The bad news is this virus still may be with us. Vincent, what are your thoughts about train halls and public transit in general?
Well, I think you have to gradually bring them back. You can't go to 100% on one day because that's going to introduce lots of virus infected people into one area. So you have to have fewer trains, I think, and that'll keep down the foot traffic. But you have to wear face masks, everyone. And if it has to be enforced, and people have to be stopped and said, excuse me, you have to put on a face mask, because that will really make a big difference. And so I see no other way, reduced numbers, but face masks as well.
It is interesting. I will say this, and Marion, I'd love to hear your thoughts about Penn Station and the MTA. But it is interesting. At the beginning of this virus crisis, there was some dispute about the effectiveness of face masks. I know I read multiple stories, and I think we talked about it on one of our town halls. You told us to wear them, but at the time, people were saying they weren't effective.
Right. The problem was that CDC was telling us not to wear them. And so they're a reputable source of information. And then they changed their minds at some point, right? And so I agree that we should, if we had started back in January, we could have made a big difference. But now we have to wear them. Yes.
Wow. Marion, about Penn Station? Sorry.
Oh, go ahead.
Two things. Yes, we should all wear face masks. Let's be clear. Let's all wear face masks. But the opening of Moynihan Train Hall will really separate and provide far more space for New Yorkers and passengers. When we are able to open up the Moynihan Train Hall, moving Penn Station, Amtrak into one area, New Jersey Transit an area, LIRR, and the subways. When you add that much space, you're going to be able to spread the people out. Having said that, the trains are still going to be the trains, and we're going to need either to make sure people are riding more frequent trains. We're going to have to figure out a way to make sure people are separated enough. And I think some of that's going to happen naturally. When we look at some of the studies that we're doing on traffic flow and how other countries are coming back, they are noticing that more people are using alternative modes of transportation other than public transit, biking, walking, working from home, unfortunately driving. And when you put all of those pieces together with the adding of the Moynihan Train Hall, it should really diminish the number of travelers. And when people are being cautious and people are starting taking the right precautions, it will help. It will help. But public transportation is a way of life in New York City. And we're going to need to be able to use it and use it in a way that really brings our people to and from work, but in a very responsible way.
Mark Diller wants to know about how people get to work if their kids aren't in school. So kids would go to camp and summer school and do other things that probably won't happen this summer. How should they expect to provide for their kids, but also go to their jobs, which hopefully have been resurrected, at least some of them?
You know, that's one of the things the governor has been talking about. It's very difficult to have one without the other.
Right.
And so this is going to have to be a very phased in, a very coordinated response to reopening, because you are correct. Summer camps may not get to occur. That decision has not been made. It has not been made when New York City comes online. And so I think all those thoughts you're having are being considered by the governor and his team. And it has to be done in a very coordinated way. It has to be done in a very conscientious way. And that's what the governor is doing. And that's how it will all have to reopen.
I think we're going to need a lot more stimulus money from the feds.
We're going to need the federal government to do everything it can, because this is not a blue state or a red state issue. This is an all 50 state issue in every country in the world.
Well, from your lips to the White House. One question for Vincent. The new cases, where are they coming from? And I think the Bronx has a lot more positives or people going to the hospital. Can you explain how the virus is affecting different parts of the city?
Well, remember that many infections, you don't even know where they are. People don't feel very sick. They don't get tested. And these people are circulating throughout society. And so in areas that are particularly more crowded, where there's a lot more street traffic, where there's more people riding the public transit, for example, you're going to have more infections in those areas. When people are contacting one another, they're going to transmit it. And I can tell you that not everyone's wearing a face mask. So that's the determinant. So you have to understand, where's the virus, you may say. Where is it? It's in you. It's in people walking around and they don't even know it. That's the squirrely part of this virus, right?
Would you say that, like on the subway, you hold on to the pole?
Mhm.
Can the virus jump from that pole, from your hand on the pole to the next person holding the pole?
Yeah. So if someone had touched their nose and got some mucus on their finger with virus in it, they could put it on the pole. And it might last a few hours on the pole, but if you touch it soon after and then you touch your face, that you could. So that's why we tell people don't touch your face, and wearing a mask helps, right? Because you can't. You shouldn't be able to, because the two
Right.
ways you get it are by the respiratory droplets and by touching.
Would you say, Vincent, that I think, again, 7 town halls ago, we were talking about wiping down your, boxes,
Mhm.
cereal boxes from the grocery
Right.
store, and making sure that, if you need to take a pint of ice cream from the freezer, that you clean it. Is the virus showing longevity on those types of common household products that we've followed since then?
Yeah, that's a good point, because since we've talked, it's been a while. Back then we were very cautious, but now I would say things that you bring in, you don't have to wipe everything that comes in your home any longer. I think as long as, if things are in packages, throw the packages away and just wash your hands. I think that's fine. And there's never been any outbreak associated with that kind of transmission. So I'm worried much less about that.
It's fascinating how we are learning as we deal with this, the virus itself. I wanted to ask Pravina and Marion a question that we get a lot from small businesses that we hope will be reopening, but boy, they are hanging on by a thread. And I was walking through the village today, and I was just thinking, like, how many of these businesses are going to be coming back? And I know it's a question you must wrestle with, but one of the things that we hear about is personal liability that many small business owners are responsible for in their leases. What are you thinking, Pravina, in terms of this rent question, the liability question, and how it pertains to commercial leases?
So we've been working with Department of Financial Services, which actually is the agency that overlooks insurance companies, obviously financial institutions and insurance companies, because as you saw, the governor put in quite a lot of executive orders around insurance payments as well as rent. And part of that is looking at that industry. You can't go back in a pandemic and say, oh, in the clause it said this, forgive the clause, right? Because the insurance rate was based on that. But we are working with that industry to figure out post-pandemic, what do we do? What can be done to help? Because a lot of people are saying, we had business interruption insurance. It isn't covering. Well, it never meant to cover a pandemic. It wasn't priced in the policy. And so you can't just tell insurance companies, well, now you got to price it in your policy. If I paid $100 and I didn't, there's a problem. But what a lot of insurance companies are doing, and you're seeing this across the country, people who had policies about fleets of vehicles, well, you're not driving your fleets of vehicles. They're now issuing back refund checks because people aren't driving. So that property and casualty on that are coming down. So they are trying to look at other ways of other parts of your policy that have not been affected the other way, where you're getting a benefit and trying to refund that. But it is an issue that we're looking at, because post this, when new insurance policies are going out, we've got to figure out, what do we do for a pandemic when you have a business interruption? How do we make sure that people are covered?
The small business owner has a question. They come to, say, Linda or my office about their lease. Is there someone we can reach out to your office for some analysis of their lease?
Yeah, I'd say go to one of our centers. I mean, they have lawyers, they have the ability. I mean, if you come to our direct office, there's no one there. We are also social distancing, but on our website, we do have all our centers, and they are able to look at people's leases and actually help them. Yeah.
We'll post that in our chat column. Thank you.
Pravina, what centers are you referencing? The entrepreneurial?
Yep, the entrepreneurship assistance centers, our small business development centers, and then on the finance side, we have 23 community development financial institutions that are helping people apply for the PPP loans. But our entrepreneurship assistance centers and our small business development centers are open and answer these questions regularly. So even post this, I would encourage people to use them. They're free resources. They have counselors on staff that are doing everything virtually and remotely. So even if you're in a different part of the state, you might talk to someone from New York City, but they will understand the concerns as well.
Oh, it's virtual then. It's
It's
virtual.
all virtual at the moment. Yeah.
Okay.
They actually do have walk-in centers, but they're all closed at the moment.
Right, right. Okay. Brad?
Well, I just wanted to ask Vincent for the final question that I have, and we've reached the close of our time, and then I'll hand it over to Linda. But Vincent, I just want to know, what has surprised you so far through this pandemic, and what did you expect? Like, what stands out at this point?
Well, what surprised me is that this virus has brought much of the world to its knees. And I don't think that was absolutely necessary. I think we could have prevented it from the start. It could have been prevented in China had we had the foresight. And I have many suggestions for what we could have done, and my colleagues all agree with me. But even then, when it first came to the U.S.,
China, Vincent.
sorry?
Since you mentioned China, do you and your colleagues believe that it originated in the lab?
No, not at all. No, it didn't. This is a product of nature, which is the finest at making new viruses for sure. And I'm happy to sit down with anyone and explain why that is. But we could have stopped it in the early days in China had we had an antiviral ready, and it was very straightforward to do that, but no one wanted to invest. When it first came to the US in January, we could have stopped it even then, even without an antiviral, by just doing more testing and contact tracing and quarantining. So to me, that's the big surprise, that we let this happen, and we shouldn't have. And I hope we learn a lesson so that next time, because there will be a SARS 3 and 4 and 5, not in my lifetime probably, but in many young people, and we should be ready. And of all the things, we could talk about the virus, how it spreads and so forth. Those are what viruses do. But the fact that we let this happen is really inexcusable, and people should be outraged, frankly.
And that's why elections matter. My little, it's not, well, I'm a Democrat. It's fine. I'll say it. The denial was the word of the day. And look what's happened. So many people have died and suffered. But our audience is lucky to have all of you. Vincent, number 3. Maybe there'll be a 4th as you share your expertise with us. And Pravina and Marion, thank you so much for sharing what the state and Empire State Development is doing to help small business and large business as well, right? Some of them need help. And they can go to your website. And I thank you all for being here with us.
And may I ask for one public service announcement?
Sure.
It is Census 2020 season. So if you have viewers online, I would encourage you, as you're home social distancing, to fill out your Census 2020, because elections matter, but the census matters. And as we go through this pandemic and we need to get more federal funding, those numbers are going to be what people will give us. So when we talk about daycare and taking care of our children in schools and hospitals, those census numbers are so important, because that's how federal money gets to the state. So you got to probably have some time on your hands. Feel free. It takes less than 10 minutes. Census2020.gov. So that's my public service announcement.
That's good. Thank you.
And I hope, we've asked the governor. We hope the governor makes that announcement at one of his love hours, encouraging New Yorkers to fill out the census. And I just wanted to thank all the panelists, and of course our ASL interpreters, John and Andrea, who are doing a great service for so many of our viewers. Thank you.
Thank you all.
Thank you for having us.
Thank you.
Okay.